Hello and welcome to another episode of Big Conversations or Ladies Corner with your girl T Ademo. Good afternoon. I hope you're well. I understand there's a heat wave going. It's been announced by the city of Edmonton from today or from yesterday till the 11th of June. Sorry, of September. Which month am I in? So I hope you are keeping well. I hope you are looking after yourselves. We have a very important conversation today with a very, very august guest. Cancer care is almost like a taboo. We don't, as Black people, as Africans, often talk about our ailments, as we often always believe that God will heal us. And our special guest this afternoon has devoted much of her life to patient care, looking after survivors of the most dreaded disease, cancer. She's Mrs. Yinka Oladele. She's executive director of Oladele Foundation, and she's also the executive director and founder of African Cancer and Support Care. She joins us from Calgary to talk to us about her life's work, caring after people who have cancer. Good afternoon, Mrs. Oladele. Thank you so very much for joining us.
Yeah, good afternoon. Thank you for having me.
Cancer is such a dreaded disease. You hear that diagnosis, or you suppose you have it, and you get into the I'm dying mode, and your life just ends. How did you get into? Could you give us some sort of a background of how you got into providing patient care for cancer patients?
Wow, thank you. I don't know what I have done to cancer myself, but I am not affected by cancer and I will not be affected by it. However, a few years ago, I lost my mom to breast cancer. And in 2016, my husband was diagnosed with multiple myeloma, cancer of the plasma cells.
Mm.
While going through the journey, we realized that there was no resources, there was no information. There was this huge gap in the health system. And so we decided to write a book to chronicle our journey. And that book was like a eye opener. It's like opening the can of worm, and people now started to reach out to us. What we do is born out of lived experience. I didn't just want to go into non-for-profits, but we know that in our community, cancer is like a stigma. It is a taboo. Hearing that you have cancer, some people are dead already, even at the doctor's office. But we provide this platform to help people come together, share their symptoms, not to be alone, not to feel lonely. Thank you.
Thank you for that answer. And I know within us as Africans, or I say Nigerians, we are very religious. Much of our time is spent praying and banishing. What role has faith played? Some people, after certain church services, they will declare that you are healed. Did you and your husband find such respite in your care? I'm asking a broader question around faith and what role that has played or not played in your journey with your husband.
Thank you. I'm from a Christian background and I'm a Christian, I'm a born again Christian. My mom, when she was diagnosed, she didn't tell us, she was praying. She got her diagnosis and kept it, praying, and we didn't even know until it was close to when she was going to pass. And so when my husband was diagnosed, of course, I listened to the doctors and I informed a few people in the community. Then pastors, even imams prayed. Cancer and faith is like they are intertwined. Some people, when they hear that they have cancer or any chronic disease, they believe that, yes, of course, I'm going to be praying, forgetting that God has given all of us talents. God has given us knowledge. He gave the doctors, the oncologists, and specialists the knowledge to be able to put these things together. In the book of Genesis, God creates heaven and the earth and everything. He created the water, the sand, the leaf, everything that we use. So my belief is everything that we are using right now were created by God. And He gave us knowledge. The knowledge He gave to IT people is different from the one He gave to scientists. And the scientists, they are able to put together maybe chemotherapy or any um, medicines that can help. So my take for anybody or anyone that doesn't want to maybe go through medical is, God hears prayers. Action, listen to your doctor, take necessary medication will help. I tell you, my house was like a church, was like a fellowship center when my husband was going through his journey. As one pastor was leaving, the other one was coming. Even the imams, they even had night vigil in my house. I didn't know that Muslims do night vigils. But with prayers, medications, taking necessary doctors, everything that the doctor said, we followed it to the T. And I did my research. So I think when people have chronic disease, while you are praying, please let us do the needful. We don't have to die unnecessarily because we are saying, oh, I'm going to pray, I'm going to. Of course, God answers prayers. There are miracles. Remember in the Bible, even Jesus Christ, there are different ways that He healed. Some He used sand put on the eye. Some He said, go and wash. So there are different ways that He healed. Some He just spoke the word. Some people can just have their healing. But if you don't have enough faith, right, please have someone that has faith to hold your hand while you take your medication. And please don't wait until it's late. There are some diseases that it is late before we get into it, before we get diagnosed. And by the time diagnosis comes, it's already late. Early detection saves lives.
Hmm.
Thank you.
Thank you very much. My father passed away about 25 years ago. He had cancer of the lungs.
Oh,
When he passed, one of the pastors that we saw for prayer said he didn't have enough faith, and that stung and hurt me personally because when you're 20 years old and your father is dying and we prayed, and for him to say that just so I'm wondering, let me bring it back to your journey with your husband. So God answered your prayers, your faith worked, and God has made the cancer go away.
mhm.
Amen. It works. So prayer does work when you're fighting
Oh,
that.
prayer does work. Don't get me wrong. My mother,
Mm.
right? My mother, she passed. Even as at that time, people were telling her, even though she was one of the people that you will call Iyajo. I grew up in Christ Apostolic Church. Then Christ Apostolic Church, they don't even use medicine. They don't do anything. People were saying, oh, maybe her faith, right, was very little, that she didn't have faith. People were saying maybe she didn't believe. People were saying maybe she sinned, that maybe her sin was just too big. So there are so many things that affect us. There are so many things that even when our pastor, even some pastors still die of chronic diseases. Does it mean they don't have faith? Pastors die of diabetics, they have Alzheimer, they have cancer. Just name the disease. Does it mean they don't have faith? They do. We serve God that does what he wants because He is the Almighty. He's right there. He's right up there. We don't see Him, we don't know Him, but we believe. We have the faith. The fact that someone prays and something goes, and someone prays for that thing and it didn't go, doesn't mean the person that is only didn't go doesn't mean he doesn't have faith. I use my mother as an example, and I use my husband. We prayed, we followed the doctor's advice. He went through chemotherapy, he went through stem cell transplants. He became like a child. While we are going through the treatment, we were praying so that the medication will work for him. It's still the same God that we serve. I hope that answers your question.
It does. It's also put it in context, and I think some of what you said, I can relate to. Do your research, do your homework, still pray. And I am also hearing the challenge. So it wasn't a cup of tea really when your husband turns to a child as he's going through the healing process. And I'm reminded of a story. My friend in the UK they discovered a lump in her breast. I think they found a lump very soon. And she said she changed her diet, she changed so many things about her lifestyle. And she's still alive today because whatever it was they found there was able to go away based on diet. Are you able to talk to us the role nutrition or diet or good living plays in averting certain types of cancer?
Thank you. First of all, I'm not in nutrition. And the thing is, whether you have cancer, you don't have cancer, I believe in eating well. I believe in eating healthier food and all those things. When my husband was going through his own journey, I heard so many things. People said, oh, maybe because we were using a microwave oven. People said maybe because the food were frozen. So many things. And I told them my mom didn't have luxury of all these things. We didn't have the luxury, right? There was no frozen food. There was no microwave oven. So, so we had a lot. Some people said, oh, you need to juice. I have a friend here, Flavors. She will come to my house. She will help me to juice. You will juice. A few years ago, we lost a lady here in Calgary. When she was told that she had cancer, she started to juice. I don't think she took treatment because she said, oh, I want to juice, I want to do this. The thing is, whatever you are doing, let it just be complementary to your treatments. Let it be complementary. Sometimes when we change our lifestyle, some people they eat old foods. I have attended different workshops to prepare food, to eat healthy food. I've done so many things. But what I have realized is God made everything. It depends on how we are able to use those things. God made the food. How are you eating it yourself? You don't just want to eat because you want to eat. Many people, they have all food and they still have diseases and chronic, they have illnesses in their body. So whether you eat all food, you eat organic, whatever will happen will happen. But we just need to do everything in moderation while we are listening to our body and we are listening to the doctors. The doctors are there. That is why they went for the training.
Hmm.
For example, social worker, that is their job. We listen to them. Psychologists, that is their job. We listen to them. And we also have doctors. That is their job. We listen to them. And scientists, every day, science is going on. For example, HIV, AIDS. It was rampant, maybe I think in 1990s. Now there is a pill that people can take when they have HIV. And I believe one day, there might be pill for cancer.
Amen. Amen. I say amen to that because it's one of the most dangerous diseases that still makes you sick just thinking about it and sick of fear of the future. Um, I want to salute you, the courage you've had with your husband and the courage to share as honestly because in our community, Nigerian or African community, we often don't talk about our pain. We often will keep it, and especially cancer. Many people don't want to be stigmatized. So, could you describe the work you do in in getting people to come to seek your help for patient care? How is it that they find you comfortable enough to disclose, I may be dying, to disclose, should I do chemotherapy, should I not? I'm just wondering if these are some of the conversations that people that you look after have with you.
Well, thank you. Um, we started a few years ago, and some people they come to us after they have started their treatments. So we meet with people where they are. When we have a newly diagnosed patient, of course, we ask them their diagnosis, how it was diagnosed, and what is the doctor telling them. We do not give medical advice. And that is why we have survivors. For example, if someone is diagnosed with breast cancer, there are different types of breast cancer. We look for someone who has that type of who has gone through that type of breast cancer, and we pair them. So the person is able to help the newly diagnosed go through the journey. And not that it's going to recommend, it could be, you know what, these are the questions you can ask. Because sometimes when people get to the doctors, they forget everything. Sometimes they don't even know what to ask. And, we are from Africa, it's a continent, it is not a country. We have diverse languages. So, language is also a barrier to some people. English is not their first language. So, we look for translator. Sometimes the hospital have translators, or we provide the translator. Some people will ask before they go. We just ask, okay, these are some of the questions you can ask based on what the person said. And the thing is, up till until now, of course, people are still shying away. They don't want their business to go out there. And at the same time, like we started a few years ago, now we have about 100 people, 100 people that have registered. And we have those that we still serve that they don't want to register yet. But we serve them. We cannot say no because you are not registered, we will not serve you. We still serve people. So when people come to us, we meet them where they are, and we are able uh, to serve them. We ask them questions, and based on what they tell us, we're able to provide resources.
Thank you, Mrs. Oladele. I have two questions I want to ask you. Do you find in your experience that cancer is a rarity or a common occurrence amongst our African community? And I hear what you say. Africa is not a country. There are about 54 countries within that continent. But in your work with African Cancer Support Group, is it a rarity? And second, I want you to comment on the app called X, that was formerly Twitter. Many people complain about the AHS and the paucity of resources, especially for cancer patients. Is this true? What is it like seeking help for cancer with the AHS? Your thoughts?
Okay. Cancer is what's it called? It's common in the Black community. Cancer is actually common everywhere. It doesn't matter your nationality or where you are from. The only problem is the Blacks, we don't get checked. We don't go for screening on time. So by the time people go for screening or for checkup, it's already late. Some people, they just go for regular screening or regular checkup, then they realize that something is wrong. And some people, they must have been going for checkup maybe every year, but one day something will just pop up. But majority of our people, they don't like to go for screening. At certain age, there is a particular test that everybody needs to do. Some of our people will not do it. Maybe you need to do colonoscopy. People don't want to do that. Maybe you need to do pap test. Some people don't even like to do it. I had someone telling me that, oh, why should I go and look for trouble? Why should I go and do tests when nothing is wrong? For example, a few years ago, a lady, a very healthy lady, she just felt sick that, oh, she was having maybe headache, and it became somehow. Then she went to the hospital. That was the last thing. That same week, she was diagnosed with stage 4. I think she passed the following week. So sometimes all these things must have spread must have spread to the body, and it will just, the symptom will just come. Some of them will not even have symptoms, but with regular checkup. We are in Canada. We are in Canada. Checkup is free. Health is free. What it will cost us is just 1 hour or 2 hours that will go to the doctor to get referral. For women, it's always good to get referral to do mammogram or to do ultrasound. Women, Black women, we have dense breasts. And some people, they'll just feel, oh, something is wrong here. Some will not even check it on time. And in Africa, there is what they call triple negative. It's a type of breast cancer that is very, very aggressive. Very, very aggressive. If it's on the left breast, usually some doctors will say, oh, just take off the left breast. But some people will say, oh, you know what, they want to do double mastectomy. But they can just do one mastectomy, just take it out. Triple negative is common even in Nigeria. So when we go for screening, sometimes it's too late. So that is why we are creating awareness. Please, all it will cost us is just take that move. Call your family doctor. Call your doctor that, you know what, I want to do my checkup. If you are a man, there is PSA test that needs to be done, maybe from age 40. Some people even have breast cancer, even men. I didn't know men have breast cancer until I met a survivor, a man that has a breast cancer. So men also need to check out. Sometimes you just see your breast somehow. Let's do the checkup. And with the AHS, I don't work for AHS, and I'm not going to comment about that. But one thing I know is my husband's oncologist is a very superb human being. He's a very good oncologist. I can say that. Maybe the way it was approached, I don't know. But I can say that my husband's oncologist is a very good person. He's a very good doctor. And his care team as well, they are very, very good. But I've had other complaints that sometimes some of our members, we had to go with them to see the doctor. Of course, we get consent from them. Some of them, when they tell us this is how they are feeling, this is what the doctor is saying. So we go with them with their consent. Some of them, if we cannot go, we tell them, okay, ask these questions. Say this to the doctor. We make them to write it maybe in their phone or get a notebook, right? Get a notebook, write these questions, because by the time they get there and the nurses are asking them questions, they may forget. But when it is written down and they are seeing the doctor, they can ask the questions. So some people, right, they may not have the same experience that we had, but God gave us a very good oncologist. And I did my research. I don't go to see oncologist or any doctor without questions. My phone is full. Any doctor I'm going to see, that any doctor my husband was going to see, if I was there, I must have question. I will have done research that this medication that you gave him is not working. This medication says this is the side effect. The side effect is even more than the medication. Is there anything that can be done? The thing is, we all need to be informed and we all need to advocate for ourselves. When you go to the hospital and you are having negative experience, please let us know. A part of what we do is advocacy. Let us know. Thank you.
I accept what you said, Ms. Oladele, and I thank you for your transparency with that. We all use the AHS with varying levels of responses. With some maybe positive, with you and your husband is positive, and on X there's just a lot of moaning. And I thank you for sharing that, that there's good news still with the level of patient care. I want you to comment on some of the challenges when you try to advocate for people or generally get people to go and do those tests, go and get your mammogram done, go and get tested, you don't know. Because I think at 40 or 45, you need to do your general body checks quite frequently. So could you please comment on some of the challenges you face as a foundation with your work in sensitizing people to some of these perils?
Thank you. Um, I think a few months ago, was given, I was speaking at a church because I'm also a speaker, right? I was speaking at a church, and after um, the events, and there was Q&A, a guy got up. It was a women program actually, but the husbands came, which was good. A guy came and said, "Oh, here's my question." I said, "What is this?" He said, "Oh, why are you saying people should go and do testing, go for checkup? That I'm healthy. I am like, why should I look for trouble when there is no trouble?" So before I answered, one of the attendee now got up. She now used herself as an example, and she just gave a scenario. Oh, the guy said, "Oh," and he knew the lady, but he didn't know what she was going through. So sometimes when we go out to do community engagement, to talk about all these things, we have all these challenges where people will be resistant. And sometimes some of the people that resist, they will still come back to us, right? In secret that, okay, my sister, please, okay, these are my questions, these are my problems. Some that will resist us in the public, they will come, they will just phone that, you know what, I was just asking that questions. My parents did this, my friend did this, my cousin had this. They will answer them. And again, I'm saying people should check themselves out. People should be aware of their body. When we are aware of what is going on in our body, when we are able to study our body, things will be easier. And if you don't know how to get maybe a doctor to check all these things, please reach out to us. We have the tools that can look into, okay, maybe you want to look for a family doctor, depending on the areas that you have. We have the tools that can help you check it out. It's always good. The Black community, we all need to rise up. The mortality rate is very high in our community, and it all stems from people not doing the needful. What is the essence of making all this money and we cannot enjoy them? What is the essence of working day and night and just one sickness? We just take everything away. Let us do the needful while we are still strong. Let us call our doctor's office and for ask to be referred. Before, they say until you are age 50, that's when they do mammogram for women. Now we are seeing women in their 20s having breast cancer. We are seeing women in their 30s having breast cancer. We have lots in their 30s that have breast cancer. So they've limited the age now. They brought the age to 40, but we are still working to see if they'll bring it down. And again, when you notice something in your body, please speak up. Don't keep quiet. Don't say, I'm going to use rub, I'm going to use shea butter, I'm going to use something to rub it. Let us speak up. Thank you.
Mrs. Oladele, I hear what you're saying loud and clear. I heard this quote that death is always around us, even though we're alive. And being mildly a pessimistic person, you one cynical question is, if I'm going to die anyhow, why must I even care? Because everybody at the end of the day will die. So I suppose part of your work is to get people to to take a bit of responsibility for their own welfare, for their own medical health, in spite of the fact that death is always with us. The quote I think says, "Even while we're alive, we're dead," something like that. But that's really cynical, and we must celebrate life. I want you to focus, I think, before we go, on your future goals and aspirations. That's for your foundation. And what more the general community can do, be it the media, be people watching, our audience, what more we all can do to make sure people, to make sure actually that we destigmatize cancer in our communities.
Thank you. You know, there are some parents that don't even want their children to know they have cancer. We see them at Baker. Some will say, "Oh, I didn't even tell my children." Some will say, "Oh, my parents don't know." Why are we doing this? Remember, when we are dead, the same people that you don't want to hear are the same people that are going to take care of us. Of course, like you said, all of us are going to die. But while you are still alive, while you are still alive, why do you want to go through the pain? When, if something is found, it can easily be treated. Why do you want to wait till it is late? For any type of sickness at all, why do we go for eye check? Why, like our vision, we go to the optometrist? Why do we go to dentist to get clean up? It's the same. The same way that we book to get our teeth cleaned up or to get our eyes checked, let us book to see our doctor. Of course, everybody will go, but why do you want to go the painful way? Why do you want to wait until something that is preventable is holding us ransom? Why we are still agile, that we still have this strength in us. Let us use this strength to save our loved ones the headache of running around while we are sick. Remember, when someone is sick and is on the sick bed, the person is not the one running around. It's the caregiver and the loved one that are running around. It is not the sick person. Why do we want to wait till that time? Now, to your question, if you are hearing, to help us destigmatize cancer, our website is www.africancancer.ca. We support cancer patients, cancer survivors, caregivers, and their families. When people go through cancer and they are survivors, cancer survivorship is more than you going to the doctor and after that they say, "Oh, cancer is gone, go home." It is more than that. Cancer survivors, sometimes when they sneeze, you think it's the cancer that is coming back. When cancer patients cough, you think it's cancer that is coming back. They live in anxiety. Sometimes they are depressed. This sickness makes people to be depressed. I'm also a mental health therapist, and I see patients. Cancer has a way of dealing with people's mental mental health. It has a way of dealing with people's mind. It has a way of depressing people. Please, you can help us by volunteering. You can help us by joining us to destigmatize cancer in our community. You can also donate to us as we continue the fight. Thank you so much.
We're coming to the end of this program. I thank you for sharing how people can learn more. www.africancancer.ca. It In a final comment, I want you to talk about your you have some events coming up. I think later on this year for Christmas. I want you to talk about how people can maybe tap into that. I hear that people can volunteer and give. But what about in terms of what sort of events are you looking up to? And in a final note, I want you to talk about Oladele Foundation as a culturally sensitive place that people can come for the kind of patient care that they need. Because I understand in today's world, in the mental health world, is all Ubuntu, Ubuntu. And in general parlance, people want to know that the support is culturally sensitive. And I want you to end on that note. Yeah.
Okay, I will actually start on that note. The our foundation, what we do is we provide a culturally appropriate cancer support. We actually the first in Canada to support all types of cancer, not just one. And we deal with people of African descent. Right? We offer mental health support, we offer psychological support, emotional support, material support. Our material support is in different phases. Our material support, we have meal delivery, whereby when we know when the patient is going to the hospital, we deliver meals to them. You know, we bridge the gap between the hospital and the patient. One thing is when patients go to the hospital, they get treatments, right? So what happens when they get home? Some people after chemotherapy, the next 3 days, they cannot get up from their bed, right? So that's where we come in to help them to clean their homes, to make food for them. We were doing that every month, but because we didn't have money, it became every other month. Then we didn't have money with cancer survivor, cancer patient. We, if they are, for example, if they are from Kenya, we look for a caterer from their country that will make the food that they like. Some people in their hospital they can't even like the food, right? So we get the food prepared for them and we portion it in the freezer so that when they come, all they do is just warm. Prevent infection. We provide cleanliness is to godliness. We help them to clean their everywhere so there is no infection. Complementary therapy. Or the baby massage, physical. People have that. You have mobile massage home, mobile physiotherapy.
We're having some difficulties hearing Mrs. Oladele right now. I think it's a question of the internet.
Oh,
Okay.
I mean,
Your screen is frozen at this time.
okay.
Oh, you're back now. Okay, would ask that you check our website www.ladiescorner.ca for more information on what we do. It's looking like we may have lost Mrs. Oladele. She was, if you are just joining us, she was talking about African cancer. Sorry, providing patient care to people living with cancer at a not-for-profit. She's executive director of the African Cancer Support Group. Mrs. Oladele joined us today from Calgary. She is, of course, the executive director of the Oladele Foundation and Africa Cancer Support Group. Today, we had been talking about um, cancer. We have been talking about cancer, the care for cancer, the care of cancer, and what the Oladele Foundation does to look after people with living with cancer. And it is a very, very terrible thing. Our internet connection got disconnected, but I think we pretty much got everything we wanted from that. I want to say thank you for joining us this beautiful Friday afternoon. We promise to come again with another august important guest on a prevalent community issue. Death is always with us. And I'm not saying this enthusiastically. I'm just saying this in a way to ask us to reflect and think. And if we think we need to do checkups, mammograms, whatever it is we need to do for our bodies, let us make sure we do that so we can push back the day of death, through cancer or whatever means. I thank you again for joining us. We hope you have a good afternoon. Do check our website, ladiescorner.ca, for more of our content, and we hope to see you next time. Goodbye.